Hello everybody, my name is Juyang Lee and today I will discuss the effects of SARS or severe acute respiratory syndrome on the lower respiratory tract. The purpose of this presentation is for you to better understand the disease that you have and to help yourself prepare from future harm. I think it's very important for people to understand the disease that they have so they can be prepared as much as possible and also help prevent others from getting the disease. Introduction. So what is SARS? SARS is an airborne coronavirus and it is caused by an infection on the lower respiratory tract. It causes critical respiratory issues when infected. SARS came from previously existing viruses. SARS is mutated from other known human-associated coronaviruses, which includes several human coronavirus and Middle East respiratory syndrome. Studies have shown that SARS did not appear from nowhere. Rather, it is a mutated version of previously existing viruses. For those of you who do not know what a coronavirus is, it is an RNA-associated virus that causes harmful human diseases. SARS first appeared in China in late 2002 as an outbreak of atypical acute community-acquired pneumonia. Now we will be discussing the symptoms of SARS. Symptoms of SARS include atypical pneumonia, dry cough, high fever, and the symptoms also depends on age groups. As a fact, studies have shown that those who are 50 years or older or those who have diabetes are more susceptible to the disease and they are actually receive more damage from this disease. The respiratory phase of SARS, such as coughing, begins 2 to 7 days after the first symptoms are seen. This is the more serious phase of this virus and it can become very dangerous. Prevalence of SARS. SARS was mostly transmitted to humans from wild animals such as palm civet and raccoon dogs. It can be spread through the air or by physically touching the person who is infected. A lot of people think SARS was a human-to-human transmitted disease, but studies have shown that it was actually the wild animals that transmitted the diseases to humans. SARS infected about 8,000 people around the world and killed 10% of those that were infected, so this is not a very small number. It is uncertain of when the next case of SARS will occur, but it is expected for a possible mutated version of SARS to occur in the future. So this new version might be even more harmful, or it might be about the same as the one that we have previously experienced or the ones that you have. But scientists and researchers are trying their best to prepare for the new disease. Prognosis of SARS. A person was suspected of SARS if they showed symptoms of high fever, which is more than 38 degrees Celsius after November 1st, 2002. It's after this particular date because this was the first date that it was recorded of the first case of the SARS disease. Or if they showed symptoms after they came in close contact with someone with SARS, then it was most likely that the person actually was infected with SARS. Or if they showed symptoms after traveling to a place where there were transmissions of SARS. So let's say you went to China during this time and you came back home to Canada and tests have shown that you actually have symptoms for SARS. It was most likely that you had SARS if you showed these symptoms after coming back from a place where SARS was viral. Clinical evidence of SARS infection is shown when it is clear that there were diffuse alveolar damage and inflammation in the alveoli. So for those of you who do not know what an alveoli is, these are small air sacs found in your lungs that's used for gas exchange. And gas exchange is very important for your body because it brings the oxygens into your blood cells and even other cells in your body. So if once you become infected with SARS, it causes damage to your alveoli, which makes a halt in the gas exchange in your body. So the treatment of SARS. So far, the most effective treatment is using the combination of antiviral drugs, such as ribavirin and interferon alpha 2b. These are also needed to stop the replication of the virus, since it's an RNA associated virus, and it can also help with the inflammation. As we can see on the right over here, this graph, it shows the effects of drugs. So if we look at the line with the square, it represents the use of just ribavirin drug. Although it has some effect, it is not quite the amount that we want. And then the next line is a circle. It's a line with circle dots on it. So this represents the IFN alpha 2b drug. Now these are drugs that helps the replication of the virus as well as the inflammation of the lungs. So both of these drugs help with the disease, but as you can see, the line with the triangle is the usage of both the IFN alpha 2b drug and the ribavirin, and we can see that it has the most effect in the treatment of SARS. So this is what a lot of doctors and researchers and scientists are recommending patients who were diagnosed with SARS to take, and it has been shown proof. We must understand that there is no treatment to completely eliminate the disease. So there are drugs here, as I mentioned before, to reduce the inflammation and to reduce the replication of the virus, but there is no certain treatments that we can use to eliminate the disease completely. So how it affects the respiratory tract. By respiratory tract here, I am talking about the lungs. So the virus caused the lungs to be inflamed, damaging the alveoli, like I mentioned before, and this makes breathing very difficult. It also fills the lungs with fluid, making it difficult for oxygen to be brought into the cells, which can cause respiratory failure. The reason why it's harder for us to breathe when our lungs are filled is because it becomes less elastic, making it harder for it to expand and to contract for the exchange of gas and for us to breathe. So it is very difficult for us to deal with this on a daily basis. So on the right here is a chest radiograph of a person who was diagnosed with SARS. So image A shows us 5 days after the first symptoms were seen. So you can see how the lungs in the center over here, right in the middle of these rib cages, are slowly inflamed. Image B shows 10 days after the symptoms, so 5 days after image A, and we can see that it expanded a little more, it inflated a little more. Image C shows 13 days after the first symptoms, and we can see how much it grew and how much inflamed it got. And then image D shows 15 days. So we can see how fast the spread of SARS is in your lungs and how damaging it can be. And we can see how serious it is. But if you use the treatments, as I mentioned before, the ribavirin or the interferon alpha 2b drugs, it will help reduce the inflammation and help it much easier to breathe, since it will reduce the likeliness of the virus replicating. So what can you do to keep yourself and others safe? So number one is to make sure to wash your hands often. As previously mentioned, physical touch is one of the ways SARS can be transmitted. So it is recommended for you to wash your hands whenever you eat or whenever you cough to make sure that you reduce the likeliness of spreading the disease. Number two is to cover your mouth and nose when sneezing or coughing. SARS can be transmitted through air particles, which is transmitted and spread when you sneeze or cough. So it is very important to cover your mouth and nose to make sure those air particles do not transmit to someone that is close to you. Number 3 is to not share food, drinks, or utensils. It is very common for family members or friends to share food or drinks or even a fork or a spoon, but it is important to keep everything to yourself when you know that you have SARS, to make sure that you keep others safe and prevent them from also getting the disease. So future applications. The early detection of outbreaks. So one of the lessons that has been learned through SARS is to make sure that we are able to detect the outbreak of a new disease. This helps people to prepare and to research to make sure that they can prevent the spread of this disease as soon as possible. But number 2, that lessons that we learned from the SARS outbreak is the importance of the effective communication to the public in the events of the outbreak. So what this means is that the most important thing that scientists and researchers must do is let the public know of the new outbreak so that we can prepare ourselves for it and so that we individually can prevent the spread of the disease as much as we can. Number 3 is the significance of research regarding the disease. So this is talk about the promotion and development of research to help find the treatment and to also help find the cause of the disease, to make it easier for us to trace back and see where it all occurred and what we can do to help prevent it. And number 4 is the strategies of containment. So how we can reduce the likeliness of spreading and how we can contain the disease so that it does not harm more people. Thank you for coming to listen to this presentation, and I hope that this helped clear out some important facts of the things that you should know about the disease. Thank you.